Alright, hello. I am going to be doing scenario 3 with the 26-year-old female with left shoulder pain and muscle spasms. I have the patient positioned in supine. They're draped. I have received consent. They stated that their pain level is currently a 5 out of 10. And I have also gone over the contraindications and precautions. I'll be using hand sanitizer and then applying lotion, then we will be beginning. The strokes I'm going to be performing are going to be stroking, palmar kneading, thumb pad kneading, ringing, and finishing off again with stroking. That's wrong with the lotion for the patient's comfort. And then we will begin. So right now we're doing basic stroking. This helps the patient get used to the therapist's touch. Lets the therapist feel out the muscles. And just kind of see where the problem may be occurring, if there's any knots, tension. And also help start beginning the process of gait control theory. So this calm rubbing motion with some pressure is going to create a non-nociceptive sensory input that travels along the A beta fibers that have a much faster rate of conduction than the slower nociceptive C fibers and A delta fibers. So they're going to head to the spinal cord, block off the nociceptive signals, and then head to the brain. As the nociceptive signals are cut off, the brain's not receiving those signals, hence cutting down the amount of pain that the patient is feeling and making them feel better, helping them relax, relieve tension. So now that we're doing the stroking, we're going to palmar kneading, which for a smaller limb, such as the arm, would be done on opposite sides. This is going to start helping to stretch and mobilize the muscle to relieve the buildup of tension, promote relaxation of that muscle. That relaxation should help with the muscle spasms as well. I know that it's a nice slow pace. Right up and down the arm. And next we're going to be doing some thumb pad kneading. So this is going to be a more precise motion of the mobilization of tissue. Go up and down the bicep. Now, with these techniques for mobilization, we are still stretching and trying to promote relaxation as well as range of motion, relieve that tension. What we're also doing is increasing blood flow, as one of the causes of spasms can be ischemia, so lack of oxygen in the muscle. What we're doing is activating the axon reflex in the nerves to cause vasodilation and contraction of smooth muscle. This is going to promote further vasodilation along with that relaxation. That will increase blood flow through decreased vascular resistance and therefore increase the cardiac output. With that increased cardiac output, we're increasing the amount of oxygen and nutrients coming to the area, as well as removing any metabolic waste that may be building up, which is going to give that feeling of just a nice well-being and reducing the spasms as we go. The relaxation of the muscle as tension is relieved will also increase the amount of vasodilation the patient experiences, as it's kind of hard for the patient to relax in general, or as most people, just a full relaxation, relieving that tension, letting it go. So the massage technique with the pressure and calming motions helps with that. The last technique we've been doing is ringing. This is probably the best one for mobilizing that tissue. Really stretches it out, brings it across. That opposite motion last thing we'll be doing is stroking one more time, just to give it a nice overall feeling and a good finish to the massage. Alright, Mr. Smith, how do you feel after that?
Good.
Alright, what would you say your pain level is out of 10?
30.
Alright, that's fantastic. We have decreased that. And what we're going to be doing is one exercise before we're done. So I want you to do some active range of motion of the elbow flexion. And what I'm doing is just taking this arm, going up all the way, and down all the way in a nice, slow, controlled manner. We're doing that 10 times for one set. Three, 4, 5, 6, 7, 8, 9, 10. Fantastic. So this is going to help promote blood flow as well with the muscle contractions in the arm. That's also going to increase that overall well-being feeling. Hopefully the oxygen to the muscle and the nutrients that are coming in will help reduce that muscle spasm further. And I will see you on your next visit. Thank you.